When you hear the word nurse, you might picture someone in scrubs taking your temperature or giving you medicine in a hospital. But did you know there are dozens of types of nurses and many of them never step foot in a hospital ward? Today, we're breaking down the most common types of nurses, what they do, and how each plays a unique role in keeping us healthy. First, let us clear one thing up. Nursing is not a single job. It is a profession with many specializations and levels. From licensed practical nurses who handle essential daily care to advanced practice nurses who can diagnose illnesses and prescribe medications, there's a huge variety. We'll go from entry-level roles all the way to highly specialized careers. Let's start with LPNs, called LVNs in some states. These nurses provide basic medical care, like checking blood pressure, helping patients bathe, dressing wounds, and keeping patient records. They usually work under the supervision of registered nurses or doctors. Training for this role takes about a year, making it a common starting point for a nursing career. Next is the registered nurse, or RN. This is the most widely recognized nursing role. RNs perform assessments, create care plans, give medications, and educate patients. They often supervise LPNs and nursing assistants. RNs work in hospitals, clinics, schools, and even patients' homes. Becoming an RN usually requires a 2- or 4-year degree and passing a national licensing exam. Some RNs go even further in their education and become advanced practice registered nurses, or APRNs. This category includes nurse practitioners, nurse anesthetists, nurse midwives, and clinical nurse specialists. These nurses often have a Master's or doctoral degree and can provide advanced care, sometimes even functioning much like a primary care doctor. Let's zoom in on nurse practitioners, or NPS. These nurses can diagnose conditions, order tests, and prescribe medications. They often focus on specific areas like family medicine, pediatrics, or mental health. In many places, NPS are helping to fill the gap where there aren't enough doctors. Beyond the core roles, there are dozens of specialties. Here are some of the most interesting. Pediatric nurses caring for infants, children, and teens. Critical care nurses working in ICUs with the most seriously ill patients. Emergency nurses fast-paced work in IRS and trauma centers. Oncology nurses caring for cancer patients through treatment and recovery. Operating room nurses assisting in surgery and keeping patients safe during procedures. Public health nurses focusing on communities rather than individuals, preventing disease and promoting wellness. School nurses helping students with everyday health needs and emergencies. Travel nurses working short-term contracts in different locations, often where help is needed most. And flight nurses providing critical care to patients being airlifted to hospitals. Each specialty requires unique skills, but all share the core mission of nursing: to protect health, ease suffering, and promote healing. Not all nurses work directly with patients. Some move into education, training the next generation of nurses. Others work in research, policymaking, or health administration. These roles still make a huge impact on patient care just behind the scenes. For anyone considering nursing as a career, the options are vast. Your path might depend on how much schooling you want, the kind of patients you'd like to work with, and the pace you thrive in. Whether you love high-pressure emergencies, steady long-term care, or big-picture public health, there's a nursing role that fits. Nursing is one profession with 1,000 faces, and each one is vital. If you found this helpful, make sure to subscribe to the Nursing Room for more clear and simple healthcare explanations. Because understanding health is the first step to staying healthy. Thanks for watching, and see you for the next time.